Every year, 35,000 people have out-of-hospital cardiac arrests in Canada. If not treated immediately, it would lead to irreversible brain damage and death. Using CPR and an AED may increase the chance of survival by 75%. Hands only CPR. Scenario 1, person down. Quickly check scene. Your safety comes first. Check for hazards such as glass, gas, fire, water, and electrical. Tap and shout. With concerns over COVID-19, place fabric over face. Call 911 immediately. Yell for help and an AED. Put your phone down and listen to the EMS dispatcher. Let's do a quick check. Is the person breathing normally like you? Are they gasping or gurgling? Is their color pale blue? This is not good. Do they have fluttering eyelids or quivering lips? Start CPR immediately. Interlock your fingers in the middle of the chest. Push down 5 centimeters. Pump the chest fast and hard at the beat rate of the song Staying Alive, 100 to 120 beats per minute. Don't stop until AED arrives or EMS arrive. This is hands-only CPR. How to landmark. Kneel down beside the person. Your knees should be close to their chest. Reach across their opposite armpit and pull your hand to the center of their chest. This is referred to as landmarking. Place the heel of your palm in the center of their chest, overlapping with your other hand and interlocking your fingers. By lifting your butt, this helps place your shoulders over the person's chest. Now lock both of your elbows. Push down 5 to 6 centimeters hard and fast. The goal is 2 compressions per second. Count out loud, as this can attract bystanders to help. After 2 minutes, quickly reassess for breathing, color, and motion. If the victim shows signs of responsiveness, color, and breathing, it is now important to stop CPR. How to landmark. Ongoing care. If the person is fully conscious, encourage them to stay lying down on their back and tell them that help is on the way. If the person is unconscious and breathing, turn them onto their side into what is known as the recovery position. Kneeling down beside the person, raise the furthest arm above their head. Place the other hand across their chest. Reach across their leg, tuck your hand under their knee, and lift so the kneecap is pointing towards the ceiling. push the crossed arm at the elbow and the upward pointing knee and roll them onto their side. Make sure the head is pointing down. Continue to monitor this person's responsiveness, their color, breathing, and motion until EMS takes over. If the person suddenly stops breathing, grab them by the hip and shoulder and turn them onto their back and immediately begin CPR. Ongoing care. Using an AED, an automated external defibrillator. You have completed cycle of compressions and an AED arrives. Open the case. Put on the provided gloves. Lift or cut shirt from person. You will now hear what an AED sounds like.
Follow wires to find gray plastic case. Peel one white pad from the gray case. Place pad exactly as shown. When the first pad is in place, peel the second pad. Stay clear of patient. Stay clear of patient. Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR.
Continue until EMS arrives. Using an AED, an automated external defibrillator. Child CPR, estimated weight 25 kilograms. You find a child down. No color, no breathing, no motion. If you can, cover their mouth if you suspect COVID. Call 911 immediately. Put on speaker. Place phone down to receive direction. Place one hand only, center of the chest, shoulders straight. The other hand cannot be on the body. There are 3 positions for the other hand. 1. Place the back of your hand to the small of your back. 2. Palm on thigh. And 3. Wrap your hand around your elbow. Begin to pump down 5 centimeters hard and fast for 2 minutes. After 2 minutes, check for vital signs, color, breathing, and motion. If none, continue CPR until EMS arrives. Child CPR. Estimated weight, 25 kilograms. CPR. Ventilations. Always begin with 30 compressions. If comfortable, tilt head and lift chin. Push head down, lift chin up. Look for obstruction. If no obstruction, pinch the nose. Provide 2 breaths of air, 1 breath per second. Do this cycle 5 times. If there is no response, continue CPR until EMS arrives. CPR. Ventilations. The pocket mask. You'll find a pocket mask in the pouch.
Pocket mask is compressed. Pop it back up so it creates a cup. Two-way valve right now. You blow in, it goes in, he throws up, it comes back to you. Filter. Install it onto the post. Now it's a one-way valve. Nose and chin. Place a straight piece on his chin. Drop it over his face, bridge of the nose. Thumb and index finger at the top on the air cushion. Thumb and index at the bottom on the air cushion. Apply a little bit of pressure. Forehead goes down and chin goes up to the ceiling. Head tilt, chin lift. Take a breath. Give a breath through the filter. Let the chest rise as you breathe.
The pocket mask. AED procedure, child and infant.
And it's okay, baby. Turn it on. Open up the fast response kit.
Remove clothes from patient's chest.
Now I know that it's an infant, all right? So there's a key, child key, infant. I'm gonna plug that in there and change the directions for me.
Infant child mode.
Okay.
Remove clothes from patient's chest.
I haven't done that to
When
anybody
patient's
yet.
chest is bare, open gray plastic case. Look carefully at the pictures on the infant child key. Peel one white pad from the gray case. Place pad in center of child's chest. Press firmly to bare skin. When the first pad is in place, peel the second pad. Place pad on child's back. Stay clear of patient. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. Shock advised.
I am
Stay
clear,
clear
you're
of
clear,
patient.
stand clear.
Press the flashing orange. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR.
Keep with me.
For help with CPR, place the heel of one hand
It's not the
in
heel.
the center of the chest, between the nipples. For
Fingers.
patients less than 1 year old, use 2 fingers instead of the heel of your hand. Push the chest down firmly. Keep time with the beat. Pinch nose, tilt
Okay,
head,
rotate the
and
mask.
give 2 small breaths. Breathe.
Chin where the nose goes. Sniffer position.
Breathe. Continue with compressions.
Gently tilt head back.
And
2
that's it.
puffs of air,
Run
1
through.
puff per second.
Say no
Look
shock
for
touch
subtle
there.
chest rise. Continue with compressions until EMS arrives. AED procedure, child and infant. Choking relief protocols. Someone's gasping for air. You ask them if they're choking. You tell them you're there to help. Ask them to keep facing forward. Go beside the person, put your arm across their chest, push the person forward. Tell the person you're going to hit them on the back 5 times with the heel of your hand. 2, 3, 4, 5. Straighten the person out. Keep person facing forward. Open heels up. Ask them to point to their belly button. Lift your arm, put your palm down, make a fist, leave your thumb out. Now swing your arm around to the belly button. Push the finger out of the way and the arm. Cup your hand over top of the other hand and 2 fingers above the belly button. In 5 centimeters and up. In 5 centimeters and up. In 5 centimeters and up. If the person goes unconscious, lay person down gently. Start CPR. Choking relief protocols. Unresponsive infant, CPR, ages 0 to 1. Remember to check the scene. Glass, gas, fire, water, or electrical. Your safety comes first. You approach an unresponsive infant. Look at the face for normal color. Tap on their feet, hands, or cheeks to get a response. Make sure infant is on a hard, flat surface, like the floor or a table. If you don't have a phone, yell for help. Position yourself beside the infant, remove clothing from chest. Provide 2 minutes of CPR. In the middle of both nipples, place your index finger on the center of the chest. Just below that, place 2 fingers down to the middle ring finger. This is the landmark. If you have concerns about COVID, place fabric over infant's face. Compress infant's chest, approximately 4 centimeters. Provide 2 minutes of compressions, then quickly reassess for breathing, color, and motion. If still no signs and haven't called 911, bring infant with you to the phone. Call 911. If still no signs, continue CPR. Unresponsive infant, CPR, ages 0 to 1. CPR, ages 0 to 1, ventilations. Always begin with 30 compressions. The ventilation technique is to place hand on forehead, with other hand under chin. Gently tilt head back. Make a complete seal over the mouth and the nose. 2 puffs of air, 1 puff per second, looking for a subtle chest rise. Adjust the infant's head and airway using the head tilt chin lift. Reassess the infant's vital signs after 2 minutes. If there is no change, immediately return to CPR. CPR, ages 0 to 1, ventilations. A choking infant. Happy baby suddenly looks frightened. Arm across baby's chest. Cup the baby's face, elbow to crotch. Support from behind, turn over, head down. In between shoulder blades, administer 5 hits with heel of hand. 1, 2, 3, 4, 5. Turn baby back, still no response. Remove the baby's clothing. Place 2 fingers in the center of the chest. 5 compressions to the chest. If still no response, turn the baby over again. 5 hits to the back in between shoulder blades. Turn over, still no response. 5 compressions to the chest again. Still not breathing properly, support back and turn over again. Apply hits if baby relaxes and goes unconscious. Turn baby on back and bring to a hard, elevated surface. Center of chest, 30 compressions. Lift chin and tilt back head, look in mouth for obstructions. Place thumb in and pin mouth. With your baby finger, reach in, down, across, over, and out. If something comes out, give a test breath. Check for chest rise. Baby regains consciousness. Lift up, bring infant with you, and call 911. Choking infant.